Here is a comprehensive summary of Chapter 11, Try-In based on the textbook pages provided. 1. Introduction and definitions. Try-In definition. The process of placing a trial denture in the patient's mouth for evaluation, GPT-8, also referred to as trial placement. Trial denture definition. A preliminary arrangement of denture teeth prepared for placement into the patient's mouth to evaluate aesthetics and maxillomandibular relationships, GPT-8. Necessity. Trial placement of wax dentures is mandatory because making corrections in the processed denture is very difficult and painstaking. Evaluation sequences. Complete artificial teeth arrangement in balanced occlusion evaluated at once. Anterior teeth arranged for aesthetic trial first, followed by posterior teeth arrangement and complete try-in. Teeth arranged in centric occlusion for initial try-in, eccentric check records are then obtained to set balanced occlusion for later verification. 2. Evaluation of mandibular trial denture. A. Peripheral extension. Buccal and labial borders, checked by moving the cheek and lips upwards and inwards, simulating chewing movements, Fig. 11.1. Overextension causes the denture to rise from the ridge and must be trimmed. Lingual extension, evaluated by having the patient protrude the tongue to moisten the lips, checking the lingual pouch, Fig. 11.2, and placing the tip of the tongue at the back of the palate to test the lingual frenum, Fig. 11.3. The denture should not lift during these movements. Posterior extension, evaluated on the retromolar pad region. Underextension is checked by looking for gaps between the denture base and tissue reflection. B. Stability. Evaluation. Pressure is applied on the premolar, molar region on one side of the arch. Lifting of the denture on the opposite side indicates instability, Fig. 11.4. Causes of instability. Teeth set outside the ridge or lack of adaptation on the pressure side. Underextended flange on the non-pressure side. C. Tongue space. Lower posterior teeth must be placed in the neutral zone between cheeks and tongue. Evaluation. Tested by asking the patient to raise the tongue after inserting the lower denture, Fig. 11.5. Immediate movement indicates lack of tongue space. Movement after tongue rises to a distance indicates lingual overextension. Causes of restricted tongue space. Lower posterior teeth set lingual to the ridge, Fig. 11.6. Upper posterior teeth set on the ridge crest. Buccolingually broader molar teeth. Lingual tilting of mandibular molar teeth, Fig. 11.7. D. Height of occlusion plane. The height of the lower occlusal plane should be slightly below the tongue for stability, Fig. 11.8. 3. Evaluation of maxillary trial denture. A. Peripheral outline and posterior palatal seal. Buccal and labial borders, checked by moving cheeks downward and inward, Fig. 11.9. Distobuccal flange, evaluated for overextension by asking the patient to open wide. Underextension, checked for space between the denture border and tissue reflection, Fig. 11.10. Posterior palatal seal, PPS, evaluated for extension using the functional scraping technique. B. Stability, evaluated similarly to the lower denture. C. Retention. Anterior retention, tested by pulling down vertically on the denture in the incisor region using thumb and forefinger, Fig. 11.11a. Posterior palatal retention, evaluated by placing a forefinger on the palatal surface of upper anterior teeth and applying an outward force, Fig. 11.11b. Canine tuberosity retention, tested by applying upward and outward force in the canine region to evaluate retentiveness in the maxillary tuberosity and PT erigomaxillary notch of the opposite side, Fig. 11.12. 4. Evaluating both dentures together. A. Occlusion and jaw relation. 5. Horizontal relation, centric relation, guided into centric relation to observe potential errors, space between upper and lower posterior teeth upon first contact, Fig. 11.13. Lower teeth sliding over upper teeth upon initial contact. Shift of lower midline relative to upper midline, indicating lateral mandibular shift, Fig. 11.14. Interclusal check records are taken to verify or remake the centric relation record if errors exist. 6. Vertical relation, evaluated using standard vertical dimension methods. In case of discrepancy, posterior teeth are removed, replaced with wax occlusion rims, and a new record is made. 7. Evenness of occlusal contact. Evaluation. A mylar strip is placed on either side of the arch in the molar, premolar region while the patient bites, Fig. 11.15. Equal resistance to removing the strip indicates balanced contact. Anterior lift checking, place a wax knife between upper and lower incisors while posterior teeth contact, Fig. 11.16a. Any wedging force lifting the anterior region indicates excessive molar contact. Correction. Softened wax is added to the deficient side until contact is even, Fig. 11.16b. Causes of uneven contact. resistant recording material, errors during rim sealing, articulation, or warpage of the record base. 8. Balanced occlusion. Verified during protrusive and lateral movements. Causes of lacking balance, inaccurate face bow transfer or incorrect condylar path registration. Correction. Eccentric records are repeated and casts remounted for major errors. Selective grinding is performed after processing for minor errors. 9. Aesthetics. Midline. Coincidence of facial midline and dental midline of both arches. Long axes of anterior teeth must be parallel to the long axis of the face. Anterior plane. Incisal edges of upper anterior teeth should form a symmetrical curve in harmony with the lower lip line during a smile. Here is the continuation of the Chapter 11 summary covering aesthetics, phonetics, approval of appearance, and the summary based on the new textbook pages. 5. Aesthetics, continued, a midline and anterior plane. Midline. Coincidence of facial midline and dental midline of both arches. Long axes of anterior teeth should be parallel to the long axis of the face. Fig. 11.17. Anterior plane. Incisal edges of upper anterior teeth form a symmetrical curve in harmony with the curvature of the lower lip when smiling. Fig. 11.18. B. Shape, size, and shade of teeth. Must conform to the guidelines outlined in Chapter 9. Clinical judgment should be combined with the patient's opinion and personal preference. C. Lip form in profile. Evaluated for distended or sunken lip contours. Fig. 11.19 AC. Distended lips. Fig. 11.19A. Remove excess wax from the labial flange or check if front teeth need to be set further lingually, inward. Sunken lips. Fig. 11.19C. Consider resetting anterior teeth further labially, forward. Normal appearance. Fig. 11.19B. Proper support provided to the lip profile. D. Amount of tooth visibility. High and low lip lines must be in harmony with the proportion of visible tooth structure during rest and maximum lip elevation, smiling. Fig. 11.20A and B. E. Individualization. Incorporate patient desires for minor irregularities, e.g., overlapping or tilting, to enhance natural appearance. Denture characterization should be planned at this stage. 6. Phonetics. Phonetics is utilized to evaluate both the position of anterior teeth and vertical dimension using specific speech sounds. Sibilant S sound. Upper and lower anterior teeth should be just out of contact, closest speaking space, when pronouncing S. Fig. 11.21. Labiodental F and V sounds. Incisal edges of maxillary central incisors should contact the vermilion border of the lower lip at the junction of moist and dry mucosa, without posterior tooth contact, when pronouncing F and V. Fig. 11.22A. Bilabial P and B sounds. Lips should contact naturally while maintaining a space between upper and lower teeth during pronunciation of P and B. Fig. 11.22B. 7. Approval of appearance by the patient. Mandatory to obtain the patient's explicit approval or consent for the aesthetic appearance of the trial denture. Advisable to invite a close relative or friend to the try-in appointment so their realistic and reasonable input can be considered. 8. Summary. Try-in is a critical stage in complete denture fabrication that is frequently neglected or restricted to minor anterior tooth evaluations in routine practice. Sequential and thorough evaluation prevents costly, time-consuming corrections at insertion. Obtaining patient consent regarding final appearance following evaluation is mandatory prior to denture processing. Here is a comprehensive, structured summary of Chapter 12, Processing and Remounting, covering definitions, waxing, flaskings, and separating medium based on the textbook pages provided. 1. Definitions. Denture processing, the means by which the denture base materials are polymerized to the form of a denture. The conversion of the wax pattern of a denture or a portion of a denture into resin or other material, GPT-8. Waxing, the contouring of a wax pattern or the wax base of a trial denture into the desired form, GPT-1. Festooning, carvings in the base material of a denture that simulate the contours of the natural tissues being replaced by the denture, GPT-8. Separating medium, a coating applied to a surface, serving to prevent a second surface from adhering to the first, GPT-8. Flasking, the process of investing the cast and a wax replica of the desired form in a flask preparatory to molding the restorative material into the desired product, GPT-8. Packing, the act of filling a mold, GPT-8. Denture packing, the act of pressing a denture-based material into a mold within a refractory flask, GPT-8. Remounting, remount procedure, any method used to relate restorations to an articulator for analysis and/or to assist in development of a plan for occlusal equilibration or reshaping, GPT-8. Selective grinding, modification of the occlusal forms of teeth by grinding at selected places marked by spots made by articulating paper, GPT. Also termed occlusal reshaping, enameloplasty, or spot grinding. Finishing, the refinement of form prior to polishing, GPT-8. Polishing, the act or process of making a denture or casting smooth and glossy, GPT-8. 2. Waxing. A. Requirements of waxing. Duplicate covered soft tissue as accurately as possible. Labial and buccal borders should fill the vestibule to increase retention and stability. Notches must accommodate frenums in size and direction. Denture flange contours must be compatible with cheeks, lips, and tongue. Maxillary palatal section should nearly reproduce the patient's palate and rugae. B. Waxing procedure, maxillary trial denture, buccal surface. Adapt 2 sheets of softened wax extending from the neck of the teeth to the flange border in slight excess. Add a thin wax roll above the necks of the teeth to contour the gingival bulge. Add bulk to simulate the canine prominence, merging it with the rest of the contoured portion. Perform gingival carving using a Lecron carver or number 7 wax spatula held at 60 carat, circ for anterior teeth and 45 carat, circ for posterior teeth. Create gingival margins by carving along finish lines around the necks of the teeth. Contour interdental papillae, convex in both buccolingual and cervicoapical dimensions, with a wax spatula at 45 carat, circ. Form root extensions, festooning, using triangular markings, make elevations and depressions prominent for canines, less for premolars, and least for molars. Perform stippling on attached gingival areas using periodontal brushes or a toothbrush, then lightly flame for a high gloss finish. Palatal surface, maintain a uniform thickness of approximately 2.5 text mm to avoid interfering with speech. Smooth the transition between teeth and flange with minimal margins. C. Waxing procedure, mandibular trial denture, buccal surface, similar to maxillary, but root extensions and gingival carvings are less pronounced. Distobuccal flange should be concave to accommodate muscle action and enhance retention. Lingual surface, slightly concave without extending under the lingual surface of teeth to prevent tongue-induced displacement. 3. Flasking. A. Preparation steps. Sealing. Seal trial denture bases to the casts using a 2 text mm wax strip around land areas, hamular notches, posterior palatal seal, maxillary, or retromolar pad and lingual border, mandibular. Dearticulation. Remove casts from articulator mountings by gently tapping the junction with a hammer and wax knife, preserving index keying for remounting. Cast preparation. Apply Vaseline, lubricant to the base and indexed keys, and soak casts in clear slurry water for a few minutes. B. Pouring techniques. First pour, flask base, fill the flask base with dental plaster. Settle cast centered into mix, ensuring occlusal plane is parallel to the base. Plaster should slope down to the rim of the flask, leaving the outer rim exposed. 4. Separating medium. Purpose. Enables easy separation of cast and mold during dewaxing and packing. Prevents liquid monomer from penetrating the mold surface, which affects fit and appearance. Prevents water from the mold surface diffusing into resin, which affects polymerization rate, optical, and mechanical properties. Types. Tin foil. Historical standard. Manipulation is time-consuming. Tin foil substitutes, cold mold seal, water-soluble alginate solutions, e.g., sodium and ammonium alginate, most common. Other types, cellulose lacquers, aqueous sodium silicate, calcium oleate, soaps, starches. Composition of cold mold seal, 2% sodium alginate in water, glycerin, alcohol, sodium phosphate, and preservatives. Mode of action, reacts with calcium sulfate in gypsum surfaces to form an insoluble thin film of calcium alginate. Application precautions, apply thin, even layer using a fine brush to clean, warm stone surfaces, avoid pooling in interdental areas. Do not apply on exposed acrylic resin teeth, prevents bonding with denture-based resin. Pack acrylic within 1 text hour of application to prevent film deterioration. Here is the summary of the remaining pages of Chapter 12, Processing and Remounting, covering selective grinding, occlusal reshaping, recovering denture from the cast, finishing, polishing, and the chapter summary. 1. Laboratory remounting and selective grinding. Purpose: to eliminate occlusal errors and re-establish vertical dimension resulting from polymerization shrinkage and processing dimensional changes. Setup: deflasked dentures, still attached to master casts, are reattached to the original plaster mountings on the articulator using preserved indexing keys and fixed with sticky wax, Fig. 12.31. Verification: if vertical dimension is increased, the incisal pin lifts off the incisal table, Fig. 12.32. Selective grinding is performed until the pin contacts the center of the table. Here is the concise, structured summary of the remaining sections of Chapter 12. Processing and remounting, covering flasking, pause and closure, dewaxing, packing, curing, polymerization, deflasking, and remounting. 1. Flasking, second and third pause and closure. Second pour. Mixed dental stone is applied to the labial, buccal, and palatal surfaces of the trial denture base. Stone is wiped off the occlusal surfaces and incisal edges of the teeth to leave them fully exposed, Fig. 12.10. Third pour. Dental plaster is poured to completely fill the flask over the exposed occlusal surfaces, Fig. 12.11. Note: in a two-pour technique, the second and third pours are combined into one. Flask closure. The lid is fitted onto the flask, allowing excess plaster to escape through the holes, Fig. 12.12. The flask is placed in a flask clamp, tightened securely, Fig. 12.13, and allowed to set fully before dewaxing. 2. Dewaxing. Softening wax. The clamped flask is immersed in boiling water for 5 minutes to soften the wax pattern, then removed and opened from the base. Flushing. Clean boiling water with a small amount of detergent is used to thoroughly wash out all wax residues, Fig. 12.14. The molds are then rinsed with clean boiling water to remove detergent traces, Fig. 12.15a and b. Tooth retention and diatorics. Ensure no teeth are lost or loose during flushing. Diatorics, retentive holes, grooves, may be cut into the ridge lap area of artificial teeth using a number 4 or 6 round bore to improve mechanical bonding with the acrylic resin. Complications of incomplete dewaxing. Incomplete wax removal leads to incomplete polymerization between denture base and teeth, causing teeth to separate after processing. Prolonged boiling leads to wax leaching directly into the surrounding plaster. 3. Packing. Application of separator. Cold mold seal is reapplied with a paintbrush to warm gypsum surfaces, avoiding contact with acrylic teeth. Proportions. Polymer, PMMA powder, and monomer, MMA liquid, are mixed in a 3:1 ratio by volume in a porcelain jar and covered to prevent monomer evaporation, Fig. 12.16. Stages of polymerization: sandy stage, first stage, stringy stage, second stage, sticky consistency, Fig. 12.17a. Dough-like stage, third stage, no longer tacky, pliable, Fig. 12.17b, ideal stage for manipulation and packing. Rubbery stage, fourth stage, stiff, resists deformation. Stiff stage, fifth stage. Timing. Dough forming time is less than 10 text minutes. Working time in dough stage is approx 5 text minutes. Trial closure. Dough is kneaded using a cellophane sheet, Fig. 12.18, placed in the mold, covered with cellophane, Fig. 12.19, and closed in a bench press, Fig. 12.20. The flask is opened, excess resin, flash, is trimmed away from borders using a scalpel, carver, Fig. 12.21. This is repeated until no flash remains. Bench curing. After final metal-to-metal closure, without cellophane, the flask remains clamped at room temperature for 30 minutes to equalize pressure and ensure complete monomer wetting. 4. Curing, polymerization, heat activation hardens the resin in a controlled water bath. Exothermic heating must be controlled to prevent monomer boiling, 100.8 carat, circ, text, C, which causes gaseous porosity. Standard curing cycles: long cycle, heat at 70 carat, circ, text, C, for 9 hours. Short cycle, heat at 74 carat, circ, text, C, for 2 hours, then raise temperature to 100 carat, circ, text, C, and process for 1 hour. Cooling. The flask is bench cooled at room temperature for 30 minutes, then immersed in cool tap water for 15 minutes, Fig. 12.22. Rapid cooling leads to thermal stress and denture distortion. 5. Deflasking. Retrieval from flask. The lid is removed using a wax knife, Fig. 12.24, and the base is removed, Fig. 12.25, or a deflasker. Pry bars are used to pop the gypsum block out of the flask, Fig. 12.23. Sectioning stone. Tapping at the junction of the second and third pores with a knife and wooden, plastic mallet separates the top plaster layer, exposing occlusal surfaces, Figs. 12.26, 12.27. 3 saw cuts are made in the investing stone, 2 at the distobical corners and 1 anteriorly in the midline, Fig. 12.28. Prising stone off. A plaster knife is used to pry away buccal, anterior, and posterior stone sections. Palatal, lingual stone is gently lifted from posterior to anterior, Fig. 12.29. Preserving cast. The denture must not be separated from its master cast at this stage, Fig. 12.30. Clean indexing grooves on the cast base. 6. Remounting. Definition. Method used to relate processed restorations back to an articulator for analysis and correction of occlusal errors, GPT-8. Types. Laboratory remount, performed routinely right after deflasking and before finishing, polishing to eliminate processing-induced occlusal errors. Clinical remount, performed at insertion stage using new interocclusal records, discussed in Chapter 13. Here is the summary of the remaining pages of Chapter 12, Processing and Remounting, covering selective grinding, occlusal reshaping, recovering denture from the cast, finishing, polishing, and the chapter summary. 1. Laboratory remounting and selective grinding. Purpose: to eliminate occlusal errors and re-establish vertical dimension resulting from polymerization shrinkage and processing dimensional changes. Setup: deflasked dentures, still attached to master casts, are reattached to the original plaster mountings on the articulator using preserved indexing keys and fixed with sticky wax, Fig. 12.31. Verification: if vertical dimension is increased, the incisal pin lifts off the incisal table, Fig. 12.32. Selective grinding is performed until the pin contacts the center of the table, Fig. 12.34. General rule, bull rule: grind buccal of upper and lingual of lower cusps, bull, to correct non-functional, eccentric errors without altering functional cusps. Use different colored articulating paper to distinguish eccentric contacts from centric contacts. A. Rectification of errors in centric occlusion, Fig. 12.35. Error 1. Pair of opposing teeth too long, deepen the fauci, do not reduce functional cusp height. Error 2. Edge-to-edge contact, grind the buccal inclines of upper cusps buccally and lower cusps lingually to broaden the central fossa without reducing cusp height. Error 3. Buccal positioning of maxillary teeth, narrow the maxillary palatal cusp, grind buccal incline of palatal cusp, and move the mandibular buccal cusp buccally, grind palatal incline of buccal cusp. B. Rectification of working side errors. Frontal plane, Fig. 12.36, Error 1, maxillary and mandibular posterior lingual cusps too long, reduce maxillary buccal cusps and mandibular lingual cusps. Error 2, only buccal cusp contact, reduce maxillary buccal cusp, palatal incline. Error 3, only lingual cusp contact, reduce mandibular lingual cusp, buccal incline. Sagittal plane, Fig. 12.37, Error 1, cusps placed mesial to maximum intercuspation, grind mesial inclines of maxillary buccal cusps and distal inclines of mandibular buccal cusps. Error 2, cusps placed distal to maximum intercuspation, grind distal inclines of maxillary cusps and mesial inclines of mandibular cusps. Error 3, no working side contact due to non-working interference, grind the paths on the mandibular buccal cusp preventing working side contact. C. Rectification of protrusion errors. Reduce distolingual inclines of maxillary buccal cusps and mesiobuccal inclines of mandibular lingual cusps. 2. Recovering denture from the cast. Sawing method. A saw is used to make cuts in several directions across the base of the cast, 2 on distobical corners, 1 anteriorly, Fig. 12.38. A plaster knife is inserted into the cuts to gently separate and remove stone sections from the denture without damaging borders, Fig. 12.39. Shell blasting. Crushed walnut shells under air pressure can also be used to blast away stone without affecting acrylic resin. 3. Finishing. Finishing refines the form prior to polishing. Flash removal. Remove excess acrylic resin along borders using an arbor band on a lathe or a large bore on a lab micromotor, Fig. 12.40. Cleaning interdental areas. Remove remaining gypsum around teeth using a round bore on a straight handpiece or a chisel, Fig. 12.41. Impression surface refinement. Remove acrylic nodules using a round bore or small acrylic stones, Fig. 12.42. Frenal relief. Provide adequate relief using a straight Fisher bore, Fig. 12.43. Surface smoothing. Smoothen denture surfaces with large acrylic stones, rubber points, Fig. 12.44, followed by sandpaper on a mandrel to remove finer scratches, Fig. 12.45. 4. Polishing. Polishing makes the denture smooth and glossy. Wet polishing. A rag wheel with a slurry of pumice and water is used for main surfaces, Fig. 12.46. Inaccessible palatal areas are polished using a Profi cup or brush with pumice, Fig. 12.47. Stippling can be added using a round finishing bore at slow speed in random circular movements, followed by pumicing, Fig. 12.48. High shine, achieved using a soft chamba wheel, woolen buff with gold rouge, Fig. 12.49. Storage. Wash the denture with soap to remove polishing material and store in a container filled with water. 5. Chapter Summary. Complete denture processing requires strict adherence to clinical and laboratory sequences to prevent processing errors. Laboratory remounting and selective grinding are mandatory steps to correct occlusal discrepancies before denture delivery.